Hey everybody, it's Dr. Dave, Psychiatry. Thanks for being here on our channel. Hope it's helpful to you. Hope the videos you've seen are useful and helpful to either you or people you care about. And you might have heard or seen my video about side effects. Today we're going to talk about something specific. If you haven't, you might want to go and watch that. But side effects, just to repeat, are things that you don't want to have happen. And one of the categories of side effects that I deal with as a brain chemistry doctor, as a psychiatrist, is unfortunately some of my medicines have a negative effect in the bedroom. In fact, recently I've had people just say something like, "Hey doc, your medicine's killing me in the bedroom." What they're talking about is a lot of the medicines that we use for the medical condition of brain chemistry called depression, which we've talked about before, is serotonin shortage. When you're using serotonin boosters, the medicines that boost serotonin, names are things like Prozac, Zoloft, Paxil, Celexa, Lexapro. Those are sort of the big five. Those medicines sometimes, unfortunately, can have a negative impact on sex. But a very specific thing needs to be talked about, because you don't just say, okay, well, you're having a sexual problem, so let's change the medicine, because those medicines cause all the problems in sex. So it's really important to differentiate between the different types of problems you can have, the different types of sex. So this is, if you're a minor watching this, talk to your parents. My hope is that if you're an adult, you're listening, because we're going to talk about sex. We'll try to use polite words, which I do in my office. But the human act of sex involves three phases. And I'm going to call those three phases the interest in, the getting ready to, and the finishing. So if you come to me and you're saying the medicine might be causing depression, the first thing I'm asking you are, if you say the medicines are messing with my sex life, well, what are you talking about? Are you talking about the being interested, the being able to get ready, or the being able to finish? Depending on those answers, I know what we're dealing with. If you say, well, I'm not interested, I just don't care, well, that's not necessarily the medicine. Because people that have really bad serotonin shortage, if your serotonin should be here and it's here, if it's low, well, you're not interested in a lot of things. You're not interested in food, you're not interested in work, you're not interested in activities of daily life. And if you feel that miserable, you're not interested in sex either. So lack of interest typically is not something we blame a medicine for. The second one, being able to get ready, which in women is being able to get enough stuff going that it's comfortable, and in men it's being able to get the thing big enough that it's useful. Those are the words that I'll use. That's not affected by my medicines either. So serotonin boosters typically don't affect the ability to get ready. Serotonin boosters like Prozac, Zoloft, Paxil, Celexa, Lexapro, if you're taking one of those and you're having a problem with the third, which is finishing, then that's a problem. Except when it isn't. Because some people say, "Doc, you won't believe this, but I really like this Prozac, or I really like the Zoloft because I'm way able to go longer." For some people, that's good. And for some people, that's actually a reason to stay on the medicine. And actually, if you ever were prescribed a medicine like Zoloft or Prozac by a urologist, who is a doctor that takes care of the reproductive and urinary parts of your body, medicines like Zoloft are used to stop finishing early. Some people have a problem with, I go for 10 seconds or 15 seconds and I'm done. And so medicines can be used, serotonin boosters actually therapeutically use a therapeutic side effect to stop that from happening. Now, obviously, if you're going in the sex act and you're not able to finish and you're going for 10, 15, 20, 30 minutes, that's ultimately either a good thing or a bad thing. If it's frustrating because you can't finish, well, then you're that guy that says, "Hey, your medicine's messing with me in the bedroom. I don't like it." And there's only one solution. You change the medicine. If you or your partner like it, that you can go longer, I have no problem with it. That's a therapeutic side effect. No issue. Until one person gets tired or sore, it's okay with me. Changing the medicine is what we do. Like any side effect, it's what we said before in the side effect video and the other video on the channel, is you have to decide if something's a problem or not. If it's a problem, it's a problem. If it's not a problem, it's not a problem. That's up for you to determine. And if it's a problem, it's pretty simple. If Prozac's doing it, we switch to something else. Maybe it's Zoloft. If Zoloft does it, we try something else. But in my experience of dealing with this issue for 30 years with patients, is that a lot of times you would think all the medicines would cause the problem, and it's not true. So it's a smart move. If a medicine's helping you for your serotonin shortage, if you're feeling less depressed, more interested, more motivated, you're getting things done and you feel well, except for that problem, don't just stop the medicine. You don't want to just stop the medicine, because you know what your serotonin's going to do? It's going to go from here to here. And then you're going to start to feel symptoms again. So we don't want that. The best thing to do is to replace your serotonin booster with something else. Now, the last thing to do is get out of the category of serotonin boosters. So if you watch the video about troubleshooting brain chemistry, you remember that there are the two major systems involved in depression. Might have been in the depression one too, the video. The two chemicals that we were concerned about for depression, which is, again, depressed mood, low interest, low energy, can't concentrate, can't focus, feeling hopeless. That cluster of symptoms, we believe that that's caused by either shortage of serotonin, shortage of norepinephrine, or both. And one of the things we do sometimes is we will add the norepinephrine booster, Wellbutrin, to the Prozac, Zoloft, Paxil, Celexa. Sometimes that helps. And sometimes we just take you off the Celexa, Lexapro, Wellbutrin, or excuse me, Celexa, Lexapro, Zoloft, and put you on the norepinephrine booster, because we really believe that this problem is directly related to the serotonin system. We don't know why, but that's after 30 years, Prozac's been out since 1987. This is a very well-known phenomenon, and the solution is stop it and try something else. And sometimes Wellbutrin works, sometimes it doesn't. Sometimes you have to work with the different combinations of medicines. If you're a patient, what that means for you is you're going to have to do some experimentation. If you're a prescriber, someone who writes prescriptions, my encouragement to you is don't just stop the medicine for serotonin. Don't just stop it, because unless the patient decides that it's just not worth trying, you really want to try to offer them something else. And a lot of times, in my experience, you can find another serotonin-based tool that does the job for depression that doesn't cause the problem in the bedroom. So that's what we're talking about, the 3 phases. I hope that's helpful. I thank you for being here on the channel today. Look forward to making future videos for you. And thanks for coming to see me today. Dr. Dave, see ya.